for internal carotid artery like Fisher classification, Gibbo classification, and Boutillier classification. And there are still more like Van Leeuwen classifications and more. So these three are the commonest one, and of which the most important one is the Boutilier's classification. So that is the one which is we are practically using it for our surgical approaches. And then is the Fisher's classification. So the segments, as per this Boutillier classification, there are 7 segments of internal carotid artery. So to start with, first is the cervical part, the part in the neck. So first is the cervical part, which extends from the C3-C4 junction, from the origin of the internal carotid artery, from the common carotid, up to the carotid canal. And then once it reaches the carotid canal, once it enters the carotid canal, it is called as the petrous part. That is the second segment. So first is the cervical part, which is the horizontal part, and then is the petrous part, which cervical part is the vertical part, and then is the petrous part, which has both the horizontal and a vertical part. So here it enters the carotid canal and runs through the carotid canal. So that is the petrous part of the temporal bone. So it enters the carotid canal and runs through the carotid canal in the petrous part of the temporal bone. So within this carotid canal, so within this petrous part of the temporal bone is the carotico-tympanic branches. These are the carotico-tympanic branches within the carotid canal. So, and once it comes out of the carotid canal, then it is called as the cavernous part. Actually, we have a laceral part. I will show you in the subsequent slides. For the sake of understanding, I am showing you this because in few classification, the laceral part is merged into the cavernous part. Okay, so then you have the cavernous part, that is the part of the ICA when it enters the cavernous sinus. So cavernous sinus is, these are the dural sinuses. So here you have the cavernous sinus. Cervical part, then you have the petrous part when it runs in within the carotid canal, and then you have a laceral part and then the cavernous part. So then it enters, then is the cerebral part. The cerebral part is divided into, that is a supraclinoid part. It is divided into the cerebral part is then divided into various segments. I will tell you the subsequent segments. It is then divided into various segments. So this is in a nutshell how the internal carotid artery is, the various segments of the internal carotid artery. And then the supraclinoid part. So this is the roughly the 7 segments of the internal carotid artery. So the first is the cervical carotid, and then is the petrous carotid, where it runs within the carotid canal. This anatomy is the most important thing, which is the most basic thing which you should understand, because here to remember the entire course of the internal carotid artery will be having as vertical, horizontal, then vertical, horizontal. So alternatively you have vertical and alternatively you will have horizontal segments. So first is the cervical part, and then is the petrous part when it is within the carotid canal, within which you will have carotico-tympanic artery and then the Vidian artery. And then this is the laceral part. The laceral part, this part of the carotid artery lies over the or runs over the foramen lacerum. Actually, it is not an actual foramen. It is actually a defect which is covered with the cartilage. So the internal carotid artery runs over the foramen lacerum. It does not pass through that foramen. It only runs through the foramen. So this is actually not a foramen. It's actually a defect which is covered by the cartilage in the adult. So that is called as the laceral part. So where it runs over the foramen lacerum up to the level of the petrolingual ligament. So up to the petrolingual ligament from the carotid canal is the laceral part of the ICA. And then once it crosses the petrolingual ligament, it enters the cavernous sinus, where it is called as the cavernous ICA. The cavernous ICA, there are 2 branches from the cavernous ICA. One is the meningohypophyseal trunk, and then is the other one is the infralateral trunk. The meningohypophyseal trunk in turn gives 3 branches, that is inferior hypophyseal artery, the dorsal meningeal artery, and then the temporal artery, which is also called as the Italian artery, or the artery of Bernasconi and Casinari. So this is the main artery which supplies the vasculature to the meningioma, which forms the principal arterial supply to the meningioma. So that is the cavernous ICA, and then it enters through the proximal dural ring or the lower dural ring, which is related to the clinoid process. So the proximal dural ring, through that it enters the clinoid segment. That is called as the clinoid segment. It is called as the clinoid segment. So it enters through the proximal dural ring or the lower dural ring, enters the clinoid segment, and up to the distal dural ring, it forms the clinoid segment of the ICA. Okay, between the part of the ICA that lies between the proximal dural ring or the lower dural ring and the distal dural ring or the upper dural ring is called as the clinoid ICA. And then is the ophthalmic segment. The ophthalmic segment, it is between the distal dural ring and the origin of the posterior communicating artery. That is called as the ophthalmic segment. So this is the ophthalmic segment. So from where we will get the ophthalmic artery. So this is the ophthalmic segment which lies between the distal dural ring and the origin of the posterior communicating artery. And then you have the communicating segment, which is between the origin of the posterior communicating artery and the bifurcation of the ICA. So here you have the posterior communicating artery and the anterior choroidal artery from the C7 or the communicating segment. So these are the 7 segments of the internal carotid artery. So that is the Bothelius classifications, which is being commonly used for the surgical classification and for various approaches. So this is the classification which is commonly used. So based on this classification, our angiographic approaches also depends on this. So to remember the various branches. So there is a mnemonic to remember the various branches. So this is a randomly, just for the sake of remembrance, this mnemonic, I'm giving you this mnemonic. It's called a VAP schema. So A stands for the anterior choroidal artery. And remember, the odd numbered segments don't give any branches except for the C7. From C1 to C7, the odd numbered segments does not have any branches. To remember it in a short way, the from C1 to C7, the odd numbered segments do not give any branches except the C7. So A stands for the anterior choroidal artery, V for the median artery, I for the infralateral trunk, P for the PCOM, and S for the superior hypophyseal artery, C for the caroticotympanic artery, O for the ophthalmic artery, M for the meningohypophyseal trunk, and the other M for the MCA, and A for the ACA. So these are arising from the various segments of the ICA. In an orderly way, so this is a mnemonic to remember it in an orderly way from below to up, from C2 to from C1 to C7. So again, I would emphasize to say that from C1 to C7, the odd numbered segment does not give any branches except the C7. So from the so this is a mnemonic from down to up. From C1 to C7, that is, calming voices make intraoperative surgery pleasurable and almost memorable. So whichever mnemonic is convenient to you, you can choose that, or if you can remember the picture, that is well and good. So C stands for the caroticotympanic artery from C2, V for the median artery from C2, and M for the meningohypophyseal trunk from C4, and I for infralateral trunk from C4, O for the ophthalmic artery from C6, and S for superior hypophyseal artery from C6, and P for PCOM from C7, and anterior choroidal, anterior cerebral, and middle cerebral from the C7.